Hi, I'd like to speak a little bit about plantar fasciitis, which is actually one of the most common foot and ankle conditions that we see. I'm Dr. Mark Bruell. I'm a podiatrist at Lakeshore Bone and Joint Institute in Chesterton and in Michigan City. I practiced in Indiana for over 25 years. During my practice time in Indiana, I've treated many patients who've had plantar fasciitis. I definitely feel that this is one of the most common conditions affecting the foot and ankle, which causes pain. At times, the pain can be quite severe. I personally have had plantar fasciitis, and I know that it is actually not a very fun condition to have. Plantar fasciitis is a pain that occurs basically on the bottom of the heel. It's closely associated with heel spur pain. You may or may not have a spur. Patients may or may not have a spur when they have plantar fasciitis. The plantar fascia is a thick ligament that starts basically in the heel, spreads out across the foot, and connects into the toes. As you bend the foot up, you tend to stretch the plantar fascia. Plantar fascia is mostly considered some sort of an overuse injury from prolonged walking, standing, different types of activities, could be running. We've even treated children who are runners with plantar fasciitis. Plantar fasciitis usually occurs in adults, but as children become more involved in sports, they can actually develop plantar fasciitis. Most of the patients, not all, but most of the patients have more of a flat arch type structure, more flexibility to the foot, and as the foot flattens, it creates more of a stretching or more of a pulling on the plantar fascia. That pull is directed towards the heel, which most of the pain is directly under the heel when patients have plantar fasciitis. The most common types of symptoms that the patients have, or what the patients would feel, would be they would feel pain in the morning when they get out of bed, or pain when they get up after sitting. Maybe they work in a factory and they get up after lunch, they're sitting for lunch, they get up and the heel hurts. Usually with plantar fasciitis pain, you can sort of walk it off or walk a little bit and the plantar fascia tends to stretch out. In time, the plantar fasciitis can get worse. Just letting it be there and not treating it, it may go away. Oftentimes it does not. My own plantar fasciitis did not go away until I treated it. There are many different treatments for plantar fasciitis. Most of the treatments are quite simple, involving some sort of arch support, foot orthotic, which is an insert that goes in the shoe. We have foot orthotics which are custom made, and sometimes the custom made are needed. Sometimes we could even give a pre-made orthotic, which is actually quite inexpensive, that allows patients to be much more comfortable with their plantar fasciitis. Generally, if you have plantar fasciitis, for the most part, you should not walk barefooted. You should wear shoes in the house. I frequently tell people to get a pair of in-house shoes. They don't have to be very expensive, but something like a running shoe or similar shoe with a thicker sole, even some of the better sandals that are made with a thicker footbed or some sort of an arch support built into the sandal could be effective in plantar fasciitis as an in-house shoes. Most people these days have either tile or wood floors. Walking barefooted on tile and wood actually aggravates the plantar fasciitis in most cases. There are many treatments beyond orthotics, physical therapy, stretching, medications, different types of splints can be used, injections can be used. Plantar fasciitis is so common that it has a lot of different treatments. In very rare cases do we perform surgery to treat plantar fasciitis. In some cases, the plantar fasciitis can progress to some sort of a nerve pain, where then people would have the typical aching pain, but they would also get either burning pain, shooting across the foot, shooting across the heel, or some sort of a numbness or tingling. At that point, the plantar fasciitis has progressed and is involving the nerves which come down here behind the ankle and come down along the inner side of the heel. When patients have nerve pain, that has to be differentiated from the typical plantar fasciitis pain, and we would either diagnose that usually with an injection, or there's other types of diagnostic modalities that we can do. Typically an injection, just numbing the nerve and seeing how the patients respond, is very effective. Of course, you have to know where the nerve is to numb the proper nerve. Once we decide that it's actually a nerve problem, many of those patients might need a small surgery to sort of release the nerve, not cut the nerve, but take the pressure off of the nerve. That would be similar to a carpal tunnel surgery in the wrist, where pressure is taken off the nerve by cutting ligaments or soft tissues that would cover the nerve. I do those surgeries. They're highly effective, and they are very delicate. We do them very carefully, and sometimes during those surgeries we may also direct surgery towards the plantar fascia. If patients also have plantar fasciitis, might make a very small cut to take some of the pressure or some of the tension off the plantar fascia. We usually don't want to cut the plantar fascia fully all the way across. We just want to make a small nip or snip into the plantar fascia, which would allow it to expand at the attachment on this inner side of the heel. These surgeries can be very effective. Of course, they have to be done very carefully. Patients have to be advised that afterwards they have to really take it easy. I usually keep people off the foot for at least a few weeks, up to a month or so, while these nerves are healing. Nerves are very delicate. We want them to heal appropriately. Ultimately, we want the patients to be happy, and I feel it's my job to help them stay off the foot and allow the surgeries to heal. If you have plantar fasciitis, or if you have any pain around the heel, please feel free to give us a call if you have any questions. You can reach our office at Lakeshore Bone & Joint at the number below. Thank you very much.